It is great to welcome to the program today Senator Tammy Baldwin, Democratic Senator from Wisconsin. Senator, we are still, as of this moment, in the middle of this shutdown. I was sort of pleased to see that some of your Democratic colleagues have started to just confront Republicans in the floors of the Capitol, which is interesting to see. I want to get your take on two things. One, do you have a sense of how long this may go? But then maybe equally importantly, we know that shutdowns are hurtful to large swaths of people in different parts of the country for different reasons. What do you expect will be the political fallout of this? And I know we're going to talk about the personal fallout as well, but the blame is highly relevant when it comes to these shutdowns politically. What are you seeing in terms of who is being blamed for what's happening?
Yes, well, I just actually came from voting for the seventh time to reopen the government and bring down costs for healthcare for millions upon millions of Americans who stand to lose access to affordable healthcare. And it is so frustrating. You're talking about the conversations that are going on across the party aisle. When you have Marjorie Taylor Greene saying that we must fix this because she sees her kids their health premiums for next year. And I have many Republican colleagues who want to address the healthcare costs. But the leaders and President Trump are saying no. My way or the highway. And frankly, speaking of the highway, the House has not been in session now for 2+ weeks. They're on vacation while we are trying to reopen the government to bring down healthcare costs. This is clearly Trump's shutdown. This is something that, as we know, he just refuses to negotiate. And you can't pass things in the Senate without bipartisan support. So he owns this.
On the one hand, polling does show that Americans agree with what you're saying. I mean, factually speaking, Americans are far more likely right now to say that this shutdown is the fault of Republicans. On the other hand, there's a question as to why the president doesn't seem to have a significant sense of urgency to end this. And the speculation is that for as long as this goes on, it sort of postpones or delays what may be inevitable with regard to a vote and subsequent release about the Epstein files. Can you tell us anything about the conversations with your colleagues as to whether you or they suspect that that is part of the lack of urgency that we're seeing from the president as a cause?
I think that he has yet to really talk to real Americans who are getting their notices about what their health care is going to cost next year. And some of my Republican colleagues are hearing from their constituents who are impacted. And that's what's creating a sense of urgency among some of them. But as we see more and more notices go out across the country, it's going to be a deafening roar. And I certainly hope, it's so clear to me. I listen to my constituents all the time. I have heard, and I can give you examples. There's Gigi from Stoughton, Wisconsin, who just realized her dream of starting a small business. She's an artist, and she has a little place on the main street there. But she's just barely getting by. She's on the Affordable Care Act, and she's also a cancer survivor. And so it's really important for her to have access to her oncologist. And there's certain things she takes because of the treatment she had many years ago. She is terrified that she will have to close her small business, go work for some big corporation that provides health care, because she will not be able to afford her insurance. And I mean, I have so many examples like that.
No, and Senator, that makes sense. But on the Epstein question, do you think that
Yes.
that's a factor here?
Well, it's certainly part of the reason why the House is on vacation. Uh, Speaker Johnson knows full well that there is a new member who has been duly elected in Arizona,
Yes.
future Congress or Congresswoman-elect Grijalva. And as soon as she is sworn in, she will be the 218th signature on something called a discharge petition that will demand the release of the Epstein files.
Yes.
And so he is choosing not to convene. And we are in a shutdown. He could very well bring the House back in session. We can pass our resolution to reopen government and bring down healthcare costs. But he refuses to do so. And I think that the release of the Epstein files probably weighs heavily in that decision, that calculation on his part.
There's another calculation I want to ask you about, which is that on the one hand, you've rejected the clean continuing resolution. In other words, one that does not include these provisions related to very important things, including the Obamacare subsidies, makes perfect sense to me on the one hand. On the other hand, there are concerns that Democrats risk ending up on the wrong end of the blame by prolonging the shutdown, or at least the perception of the shutdown being prolonged, by insisting on the policy riders rather than just saying, well, let's just vote on the shutdown, let's vote on the continuing resolution. Talk
Yes.
about why you presumably you believe that you're doing the right thing, otherwise you wouldn't be doing it. Talk about that balance between the riders and reopening government and the importance of this.
So, through the passage last summer of the big ugly bill,
Mm-hmm.
there is now an impending healthcare crisis. They cut nearly $1 trillion out of Medicaid. Um, Eligible people will lose coverage because of that. But much more immediately, this big ugly bill was predominantly a tax bill.
Yes.
And while they passed big tax breaks for big profitable corporations and billionaires, they didn't see fit to include a tax break for hardworking American families to afford their health care. And that is an imminent crisis. As we have been having this debate, people have been getting their notices, and it is just skyrocketing. And we need to act urgently. Open enrollment for healthcare plan or for shopping for your healthcare plan starts November 1st.
Yep.
We have to act with urgency, and a wink and a nod from Leader Thune and Speaker Johnson is not going to be sufficient. So we need to reopen the government and have an ironclad commitment to deal with this crisis
Yeah, where
on
I
healthcare.
struggle it's sort of like if you have $100 and requests for $200 from the people around you, choices have to be made. There's $100 to go around, right? And if we apply that, there are people being hurt by the government being closed. Opening it would provide them some relief. But also there are people being hurt by these subsidies being on the chopping block and the price increases that we're talking about. How do you evaluate and determine who do we help first and who do we help more? It seems quite complicated politically.
Look, the healthcare crisis is top of mind. Think about our last election, if we want to do a political analysis of it.
Yep.
President Trump diagnosed the problem correctly during that campaign. Costs are too high. People can't afford their rent. They can't afford housing. They can't afford childcare. They can't afford groceries, and they can't afford health care and prescription drugs.
Yeah.
The problem is when he took over the presidency, his policies have done just the reverse. They haven't brought down costs on day one, as he said they would. Costs have gone up. The tariffs, the big ugly bill. It is a crisis for so many American families. And so this is something we must do with urgency. The estimate is that 15 million people will lose their health insurance uh, because of the big ugly bill and the failure to extend the Affordable Care Act tax breaks for affordability of people's premiums. And that is, in my mind, of paramount urgency.
Well, Senator, you've identified one of the difficulties with the populist rhetoric, which is we often hear diagnoses that make sense, as you're pointing out, but when it comes to the solutions, all of a sudden we say, "Wait a second, that's not really the right solution here." Senator Tammy Baldwin from Wisconsin, I know you've got a busy day. I appreciate you taking a few minutes to talk to us today.
Thank you so much for having me.